Good afternoon. Welcome to Monday Live with Braca Strong, Dr. Bushkin, Lily from Color, as well as Nikki Mohan, our host, as we are so excited here to have you today speaking about Caribbean Heritage Month. And please join in while we're waiting for all of our guest speakers to join in. Hello, Nikki. Welcome.
Hey, happy Monday to you.
Happy Monday. How are you?
I am so excited to be joining you today to talk about, I just opened my genetic testing kit, and I'm so excited to let everybody know the possibilities of what we can find out and what we can do when we know what our genetics are telling us.
Definitely, 100%. Well, I have a really cute visitor with us as we're waiting, and I figured I'd let him pop in and say hi. You want to pop in and say hi? Look at how cute this piece is. Is this so
Oh,
cute?
is that your
He's
son?
sitting with me today. So this was my icebreaker on how I get to hang out and have my story. So I'm so excited, and I really appreciate you coming on and, you know,
Hi,
being,
guys.
Hi.
hello,
Can you see
welcome.
Dr. Bushkin?
We cannot.
Not yet, but we'll await him.
Okay.
But, how was your weekend? How was the event on Saturday?
The event was absolutely amazing. We screened 19 women who were underinsured or uninsured. We have a list of 4 women that still need
Not yet.
screening. So we are
Yeah.
super excited and can't wait to be able to have our next event for mammograms, as we really realize obviously the need in our community. Forget what our stats show us, but just the needs in our community, and the women that drove by the event who just stopped by was awesome. Like, we just had people stopping by, saying hi, making sure what it was, what we were offering, and having Genesis Care was an amazing thing. Dr. Luna was there, so it actually really showed their company behind them and their physicians,
Yeah.
which was really nice. Dr. Luna was a sweetheart. It was an amazing
Yeah.
opportunity.
Tracy, that's so awesome. And this is a continuation to what we're doing today, right? Which is, we're talking about, how important breast screening is. And I see some folks from the Bahamas tuning in. Hey, Bahamas, this is all about you today, because June is Caribbean Heritage Month here in the United States. But the information we're getting, because we live in places like South Florida where the Caribbean population is so concentrated, we're learning so much information about how cancer, specifically breast cancer, affects Caribbean women of color, in ways that we can work towards prevention, work towards knowing what our risks are, so that we have a better chance of long-term survival and a better chance of the proper care. Because as you know, Tracy, in your journey, it's that if you catch something early, your care is so much different.
100%. I was at a personal doctor's office this morning, and one of the physicians said to me, he's like, if more women knew their options and knew the preventative measures that they could take, we wouldn't have to go as far as we do and catch women so much later in stages, where breast cancer can be caught earlier, but it's early detection, and many women from different ethnicities, different nationalities put off that testing, which is why it's being caught at later stages, and why we are where we are in our community with breast cancer, as
Absolutely.
we've made so many changes in our community. But again, it's about the patients, right?
Yeah.
Hey, Dr.
Tracy,
Bushkin.
Dr. Bushkin's here. We have Dr. Frederick Bushkin, who's a breast surgeon at Genesis Care. So good to see you this morning, doctor. How are you doing?
I'm fine, thank you. Nice to see you both.
Good, good. We're just having this conversation. Tracy had a big event over the weekend, and they're starting to screen women. As a breast surgeon, as we talk about breast cancer and the risk, how much is early detection and knowing your genetic status a big help for you when they come into your surgeon and they need care?
It's very important. Every woman we see, with or without breast cancer, we take a history to find out their pedigree, as it's called. And some women come for women care, or for high-risk lesions and not cancer. And then we go down a different path when we get a family history. Those women with breast cancer, it's absolutely part of what we do to see about genetic testing. The trend today by all our societies is to have every woman have genetic testing, and particularly the Ashkenazi Jewish women, even without a family history, we feel they should all be tested as well.
Yeah, and Lily Cervias is joining us. She's with Color. I have my Color kit right here. I'm going to do my genetic testing this month. And of course, if you're just joining us, this is our Caribbean American Heritage Month discussion on breast cancer awareness and specifically genetic testing. We're learning who is more at risk in ways that we're constantly finding out. And Dr. Bushkin will address the research and things he's finding out in his practice, being a practicing physician here, a breast surgeon at Genesis Care in South Florida. But really and truly, BRCA Strong, which is led by this wonderful lady, Tracy Milgram, is the reason we're here today. And Tracy, talk about your cancer journey and specifically your breast cancer journey. You know, at a very young age, you had the BRCA or the BRCA gene at a young age, and you were very proactive.
Well, thank you so much, Nikki, for joining us today and hosting this. We have an amazing panel today. And as Nikki said, I'm Tracy, the founder of BRCA Strong. And at the age of 21, I found out I carried a genetic mutation. And I found that out after undergoing 2 lumpectomies at the age of 18 and at 19, which were benign. And at 21, you know, which was back in 2004, don't want to date myself, but, you know, since 2004, a lot of things have changed. And, you know, finding out that I was BRCA 2, at the age of 21 changed my life. And knowing that I could be ahead of cancer, as all of my family had breast cancer and my youngest aunt died at 40, I knew that I wanted to be proactive. So I did genetic testing, came back positive, rushed, had my children, and after my children, I was like, it's time to have a full hysterectomy and a prophylactic bilateral mastectomy. You know, that's where BRCA Strong came in, is the community I felt was lacking women who were like me from when I was diagnosed in 2004 until now. And that's how I created BRCA Strong, was going through this journey, knowing that we need support, and not only support from other women, but caregivers, physicians, nurses. We all play such a big role. And when we come together, I think our healing journeys can really make a difference. And that's the imperative part, is having the accurate information, finding out early detection, and being proactive about it. Not even if you're going the surgical journey and just going, you know, your surveillance. You can do either. For 12 years, I was under surveillance every 3 months or every 6 months.
Those
I had
tests, those tests are so important. And we're going to get to Lily in a minute, because she's going to talk to us about, you remember when you first took your genetic testing, it cost you $3,000. Now we can have a prognosis, or at least know some things about ourselves, for under $200 if we use your coupon this month, which we're going to talk about. But I want to go back to Dr. Bushkin, because Dr. Bushkin, you said as part of your role in Genesis Care, you know, who should get genetic testing? And this is always something that's at the discretion of you, the surgeon, and the history. But as you're finding more and more women of Caribbean descent, especially when they come up here from the Caribbean for care, and here in South Florida, that need treatment from you, what are you finding out in your, because you talk about Ashkenazi Jews, we've known about, you know, the risks for Ashkenazi Jews. What about the risks that you're seeing in your office, that you're presenting from Black women and Black Caribbean women?
Yes, just to make the comment, we have society guidelines, the American Society of Breast Surgeons, the National Comprehensive Cancer Network, and I have them at my fingertips and on my computer, and use it as an informative teaching tool for the patients. And we could go over them. There's quite a few. We in the field do it on a daily basis. But it's sort of a living document. And Tracy and Lily will tell you, there's other areas now that are being identified. And the black letter law of what's written today is going to change and may include information on other groups, like we did many decades ago with Ashkenazi Jewish women. It's been said in the Black population, and I went to Howard University Medical School in DC. So not only that period of time, but lifelong, my appreciation of African-American women and the data that's unique to that group seems to be a bit different. And certainly we're now saying, and Lily could address this in more detail, based on recent studies, the women that are coming from the Caribbean seems to also be a nidus or a focus of increased risk. So probably more genetic research needs to be done in that group of women. And I look to the geneticists and the research scientists to provide information in our journals. Every month, the Annals of Surgical Oncology, there's a section on breast, and we read all those articles on a monthly basis. So we look forward to the work being done in that group of women. And certainly I've seen many of the women we've talked before on our meeting, that some of the women come with advanced cancer. Is it because of the care or lack of care, or is it because of the genetic susceptibility of what's called a triple negative cancer? So I look forward to the comments by our panel geneticists to provide further information.
Thank you so much. What a wonderful segue to Lily Cervias joining us with color. She is a geneticist, and Dr. Bushkin has said we need more people like you in the world. For around $200, we can find out what our code is, what this genetic code is going on that could help save a life. Tell us about it.
Yeah, so I'm a genetic counselor. I started at Color about 6 years ago, and what really drew me to working there, having been in the clinical field working with doctors like Dr. Bushkin, was this mission to increase access to information. So being able to deliver a patient-initiated test where individuals could work with their doctor, but unfortunately, as I'm sure we've all learned very, in a very real way this last year and a half, that healthcare is not always equitable, and women and men and people may need different access points to get the information that they want. And so Color allows people to purchase their test. It's always physician ordered, and they can learn if they have a mutation in a gene like BRCA1 or BRCA2, as well as others, to then take that information back to their doctor. And hopefully then we end up with more people in Dr. Bushkin's office who don't have advanced cancer. They're there because they find out, like Tracy, before they get cancer that they have a mutation, and then they can do things like preventative mastectomy or oophorectomy to lower the chance of getting cancer or prevent it from happening entirely. And I think we are learning a lot with regards to different populations that have increased risk that maybe we weren't aware of beforehand. And I've been lucky enough to do some research in the Caribbean, specifically Trinidad and Tobago. We work with a researcher there where she tested individuals who'd had cancer diagnoses, and they met what were traditionally the National Comprehensive Cancer Network guidelines for testing. And we found amongst testing in that population in Trinidad and Tobago, over a 20% mutation rate on a 30 gene cancer panel. So 1 in 5 of the women we tested, and these were women who had, early onset breast or ovarian cancer. So higher risk to begin with of having a mutation, but that 20% is definitely higher than you would find in the general population, in the United States, something like that.
Yeah.
And there's been additional studies and research that have been done across different Caribbean islands. The Bahamas, for example, they also have a very high mutation rate. There's a handful of specific BRCA1 or 2 mutations that are called founder mutations. So they're just very common within that island. And then lower mutation rates, but still significant in other islands like the Cayman Islands, Jamaica as well. So there's, I think, as we learn more and, hopefully as these articles keep coming out, this will get incorporated into the guidelines so that if you have a woman or a man or someone in front of you who comes from one of the Caribbean islands, maybe they'll divide it up by island, but if not, just saying here's some additional information that may make testing this population really helpful and worthwhile so that we can learn if there is something there to take different action, do something preventative and proactive, because the way that you treat a person who has a mutation is sometimes a little bit different than the way that you would treat someone who doesn't have a hereditary cancer running in their family.
Yeah. Research is power. I mean, I have a history of stomach cancers in my family, gastric cancers. Is this something that, this test will be able to tell me what are my risks for continuing that, Dr. Bushkin?
Yes, there's actually specific syndromes for gastric cancer, pancreas, colon, etc. So the answer is yes. And it's actually to make the point, when we test women and occasionally men. I have a man now 35 years old with breast cancer. I just saw him, he's being tested not only for the gene, but we do what's called genomic sequencing, we take an individual tumor cell and do what's called mammoprint blueprint. We can calculate the risk for a man or woman. But it's important to know, we say BRCA. BRCA1 came out, then BRCA2 was identified about 20 years ago or so. But when we do the panel, it's called the multi-gene DNA panel. It's over 50 different genetic mutations that we study. And many women can be at very high risk for breast cancer and other malignancies and not have BRCA. PALB2, CHEK1, we have other genes. So in the common parlance that women know, and rightly so, in the recent years, it's important to know that we test for about 50 different genes, and it could be other things, melanoma, colon cancer, gastric cancer, etc. So that's important. It's part of our daily practice to obtain those specimens. And there's many, many fine laboratories now. There used to be only one that have the scientists that do genetic testing. It's a whole new world.
Yeah, wow. I feel sometimes here listening to you guys, I feel glad to make it to 50. I'm turning 50 this week. Tracy, you try to empower your population with BRCA Strong. I know at Genesis Care, they take care of the whole well woman, as Dr. Bushkin has explained to us. But what you empower women to talk to your doctor, to connect them with a geneticist. I've never been offered a geneticist with all my family history of cancer.
So I wasn't either. And I think that's really important. And that's one of the reasons I try to have Lillian involved in so much, because it's so important that we know about genetic counselors. Like Dr. Bushkin explains, it's melanoma, it's stomach, it's lung, it's for men testicular, there's so many more problems that are associated with BRCA that we just don't talk about. Everybody's like, oh, well, it's your breast or your ovaries. No, it's about the woman or the man from head to toe. And that's kind of where we really play a role and educate the community on where to go and who to see. And I partnered, with BRCA Strong with Color. And if you are interested in the test, you can feel free to reach out to us. You can go to color.com and use BRCA Strong, and the test will cost you $150 versus $200. And my first genetic counselor that I ever spoke to was Lily. And I met her almost 5 years ago after being tested in 2004 to then. And I tell you, if I had a genetic counselor by my side, I think my situation would be totally different, because I was more aware of what was truly happening, instead of saying, oh, worry about your breast and your ovaries. No, you have to worry about everything in that aspect.
Yeah. And I think what, a lot of people will say, well, this is a lot of information, right? What do I do with it? Something's going to take us from this earth. But Dr. Bushkin, you get this information in a test from someone like me with a family history who may be considered high risk. How does that then plot my care differently from that point forward once I have this information?
Well, that's important. Some of the primary care physicians order it, and then what do you do with it? Some of the gynecologists order it, and what do you do with it? And I support all that. I mean, to take a good history and get the information, and you need to see those of us that are trained clinically. We are not geneticists, but we've taken courses and we're certified in genetics as clinicians. We don't have graduate degrees in genetics, but we're knowledgeable, and we do rely on our expert colleagues to get involved. So it doesn't matter who orders it. It matters who's going to interpret and provide the guidance for the patient. And just to make it a point to let you know, BRCA1 and BRCA2 genes are very, very different. And if you have the BRCA2 gene, I refer those patients and do not have cancer to at least 6 or 7 different specialists, including dermatologists. The melanomas are increased, not just skin, but uveal in the eye. So you have to go to people like myself and the men and women that do what I do. And there's many fine men and women breast surgeons. Not all breast surgeons are involved in this, to tell you the truth. But just to make the point for the community, if you have the BRCA1 gene mutation, the risk of breast cancer approaches 75% lifelong. The risk of cancer of the fallopian tube and ovary is about 50%. So we have a lot of very difficult decisions to make with a woman and her family. And very often the woman will have bilateral nipple and skin sparing mastectomies and immediate reconstruction. And the woman, you can't even see they had surgery. The plastic surgeons we work with are not any plastic surgeons. They're plastic surgeons that are trained in breast cancer reconstruction. So you have to get the team, if you will. And the women have a nice figure, they look nice. And, you know, it's a difficult time for the woman and her partner and her families. And the result cosmetically is outstanding. Also, the risk of fallopian tube and ovarian cancer is 50% lifelong. So those women, as Tracy was saying, can have their children, if they want to have a family, they try to have their children before age 35. The recommendation is to have either laparoscopic or robotic removal of the tube and ovary by 35 because things change. So as you can hear, there's a lot of science here, a lot of experience. All the societies are involved, and the work that Tracy does and Lily does, we're all colleagues and take care of the same patients.
You know, that's so important. You talk about how a woman feels and going forward, because again, this information is power. You know, Tracy was able to say, listen, I know I am at risk for a high cancer, and I, you know, want to make sure I have children. I want to be a mother. And then Tracy, so much of what you do at BRCA Strong is about helping women understand that your life will change after a cancer diagnosis, and how you look, how you feel, how you act in relationships. I mean, and that's so important. Because again, like Dr. Bushkin says, they're empowering the woman to feel good, to want to live. And that's a big part of cancer care. Talk about what you do at BRCA Strong, Tracy, to help empower women to keep going throughout this difficult time.
So we constantly do education like today, as well as work with other specialists all over the world to educate women and inform them on knowing their options. And one focus that we really do have is knowing your breast reconstruction options. There's no standard of care for breast reconstruction, unfortunately. It's all over the map, and women aren't offered all their choices and then run into difficult infections. So we want to make sure that you know all your options for breast reconstruction. And if you go on our website, you can see all 15 of them listed from A to Z, because those options are imperative. This is a life-changing decision. And if you're BRCA, just like I am without a cancer diagnosis, cutting off healthy breasts was not an easy decision, but knowing my options really helped me. So knowing breast reconstruction options, connecting women who have the same diagnosis, who look like you, who feel like you, and advocating them through their journeys. And then at BRCA Strong, we provide free post-mastectomy and pre-mastectomy care packages. And the care packages help you feel whole again. These packages include bras, robes with drain holders, and pillows. And these are all pieces that you need to help you heal, that help you through the transition. Because it's just not about surgical, right? It's mental, it's physical, it's everything else that goes along with it. And I feel like I didn't have this 6 years ago, and during one of my revisions, I definitely had these, and it helped me think a little more clear and more comfortable, because I had stuff that I was comfortable to wear. I wasn't sitting home in just like a schmatter or a ripped t-shirt and people were coming over. You know, I already lost my breath. That was bad enough. And now you're just going to come over and I'm going to be sitting sad. No, let's keep that look going and maintain who you are. And that's really what we do here at BRCA Strong, is make sure that we advocate you, educate you, help you financially and emotionally, give you garments that you need, provide lymphedema sleeves, provide prosthetics. These are all things that were not available to me that are available now, and that every woman that goes through that door for a mastectomy or goes through chemo or radiation deserves one of these packages in their hands. And I feel that we focus on eliminating the feeling of isolation and helping you feel whole again. And these are items that have helped women all over the country. We've sent out 75 packages since March. And we're going to continue going, because I want to educate on knowing your breast reconstruction options and your genetic mutations. Like Dr. Bushkin and Lily said, it's just not BRCA1 and BRCA2 anymore. And Lily, maybe if you want to touch base on like PALB2 and check, and all these new mutations that are coming along, you know, have changed over 20 years. You know, I saw a lady yesterday at screening who was from Jamaica who had an inconclusive test. and she wanted more answers. She has 2 abnormalities in her mammograms. So I said, be in touch with me on Monday and I'm going to get you some more answers. She's like, I want to do another test. And I'm like, do it. You know, one thing that I've heard from all my fellow colleagues and physicians in the community is it's okay to get a second genetic test. It's the same thing as getting a second opinion. You know, sometimes you can get more information from different companies. I know from my first test to when I had it 4 years ago at Color, it was identical.
Wow. Yeah, it's National Cancer Survivor Day, so it's really important. We realize more people are living, right? Cancer is not a death sentence anymore. And so much of that has to do with the prevention work, Lily, that you guys are doing out in the community.
Yeah, and I want to talk about a couple of things like Tracy brought up with, like, you know, years ago, the only genes that really typically got covered for when there was a family history of breast cancer, ovarian cancer, just a strong family history of cancer, were typically the BRCA1, BRCA2 genes, maybe a few others. And then, as Dr. Bushkin mentioned, we now do these large panels where we're testing, you know, 30, 50, you know, genes at a time. And that gives women more answers. We do find that the genes like BRCA1, BRCA2 tend to be pretty common. Mutations in those genes tend to be pretty common. But there's others, like a gene called CHEK2, which increases risk for things like breast cancer, as well as colon cancer and prostate cancer in men. PALB2, which also increases risk for breast and ovarian cancer. And then there's many others as well that increase risk for other types of cancer. So, for example, if I saw a family history like yours with a lot of stomach cancer, I'd be worried about some hereditary diffuse gastric cancer syndrome, as well as a hereditary syndrome called Lynch syndrome, where we see an increased risk of GI cancers. But now that this has become a more affordable, accessible type of testing, you can test many genes at once and get more answers for people.
And it's a simple saliva test, correct? I'm just looking at the kit.
Yeah, just saliva. So you give about a quarter teaspoon of saliva. We're able to extract your DNA and look at many of your genes to see if there's any changes or mutations that would increase risk for cancer within them. Now, what Tracy mentioned also is that even when we know there's a family history, or sometimes someone even has a diagnosis of cancer and we do testing, we may not get an answer, or we may get an answer that we don't exactly know what it means. It's a mutation that isn't classified as pathogenic or harmful, or it isn't classified as benign or unharmful. So we need to do more research and follow it over more time to see if that classification changes. So we get these variants or changes where we don't know enough yet. Sometimes we don't find anything at all. We find a completely normal test. And in those cases where if there's a family history or personal history, we know that maybe we'll find an answer later as more genes get discovered, or we know that maybe this just isn't due to a genetic mutation. Maybe there's other things going on in this person's, you know, body and the environment that's causing this higher cancer than we expect by chance. Or in your case where you don't have cancer, but you have a family history, maybe there is a mutation running in your family, but you happen to be lucky enough not to inherit it, because not everyone in the family ends up with the mutation.
Yeah, and you hear that a lot because, you know, in the Caribbean, we're so mixed. I mean, my father's side of the family is Indian. My mother's side of the family is Latin and Black. You know, so there's a lot of different things. But Dr. Bushkin works for a company called Genesis Care, which is actually headquartered out of Australia. So Dr. Bushkin, you have the access to so many different types of care, right? And research and approaches. You know, coming from this company from outside of the country that operates here, you see the way that different countries approach this issue. Can you talk about that?
Yeah, if I may, I will answer that certainly. And I want to talk about that. It's important to me and to all of us. But as Lily is saying, if you have a significant family history and you don't have the gene mutation, you may have a variant, and it's not clinically significant. It's not actionable. So, but those women, you can't ignore the family history. We follow them with what's called the high-risk protocol. So in addition to mammogram and ultrasound, we get breast MRIs on that group of women and examine their breasts twice a year. I'm part of Genesis Care, and it's a international group of cancer specialists that began in Australia, very successful, at the forefront in Australia, also Great Britain and Spain, and now the last couple of years is all over the United States. And it has outstanding physicians, it has outstanding leadership, it has people in the academic world, research world, and we all interconnect. Being in Florida, it's very strong in Florida, and We work with each other all the time. We're on the computer daily communicating both information about the company as far as practice patterns, but also scientific information. So it's called Genesis Care, and we have outstanding leadership. And I think you'll hear more from this company going forward over the next few years.
Yeah. I mean, Tracy, talk about, go ahead, Tracy.
Lily, there is a question for you. Can anybody retrieve it? I can't pull it up. If not, Kamali, can you resend the question? I saw it. It was, Kamali, if you're still on, please send me the question again through comments and we'll answer. If not, I will connect you with Lily and get you some answers.
Yeah.
It's one of our ovarian cancer BRCA women. So if not, I'll get back to you. Go ahead, Nikki, sorry.
I mean, we're at a time now where unfortunately a lot of people are losing their insurance, right? Because people have lost their jobs and things have changed. How can people afford to get the type of care if they're concerned about it, or they're coming from the Caribbean where they move here and they don't have insurance? But this is so important. How can they access care to help in their journey?
There's a couple options that I know for funding for genetic testing that we can talk about. I think there's some clinical trials going on in Jamaica, in Turcos, and I think there's a couple clinical trials, if I'm correct, Lily, that we could.
And you're going to put that information on BRCA Strong?
And I can put that on BRCA Strong as well as stats. And then if anybody's on the call that's interested in finding out more information, you can feel free to send me a message or send me an email to tracy@brcastrong.org. You can find us on our website, Instagram, any way we can, but there's definitely programs out there for genetic testing, for you to see a physician. You know, we don't want women to put off their screenings due to the fact that you can't afford an MRI or a mammogram. We at BRCA Strong will be doing more mammogram events with Genesis Care, and there's MRI foundations out there by Christina Applegate. Don't forget to get your screenings. Breast cancer does not quarantine. We're catching women at later stages instead of earlier, so our mortality rate and all of our numbers have increased instead of decreased because women are getting caught at later stages.
Yeah. And as we wrap up this conversation, Dr. Bushkin, anything you'd like to leave us with that we didn't get a chance to get to because, again, we just got caught up in the energy of this?
Yes, I think an important point, and we talked earlier, is identifying additional groups of women based on heritage, like the Caribbean women, like we did some years ago with Ashkenazi Jewish women. And that was where we were years ago. So we've expanded our fund of knowledge and have a high index of suspicion when we see women of different backgrounds. But you can have a gene mutation and be from the Scandinavian country, and just as an example. So not the same statistics, but the history is so important, and we take the time. I see women in my consultation room, every new patient, we sit and talk to each other probably for 30 or 40 minutes before we do the physical exam, and then come back and go over everything at that time and make recommendations. So we're very dedicated to the men and women, mostly women, that we see. And I think they leave the office very well informed and have some confidence in the system that we have in place. And now very strong with Genesis Care. We have a very nice modus operandi, if you would, for these women.
Yeah.
All right. Let's see. We have the question. It came in.
What would you recommend to a 26-year-old with elevated PSAs and both with a 28-year-old with ovarian cysts, both BRCA2, and they had ovarian cancer? They're from the Dominican Republic.
Yeah, so there's really good guidelines for if someone has a BRCA2 mutation from the National Comprehensive Cancer Network. So obviously, if it's someone who has elevated PSA levels, that's a male, that's a prostate-specific antigen. For a 28-year-old with ovarian cysts, for what she should, that's a woman, obviously, what she should be doing for screening. If they're both known to be BRCA2 positive, there's very clear guidelines and recommendations for what they should be doing. Of course, they should talk with their doctors because this screening plan is not one size fits all. It may be tailored depending on the personal or family history. But if you're having rising PSA, probably working with the urologist, working with your primary care to make sure that's being followed, and you're knowing if it gets too high where you actually want to, do a biopsy, do something to check it out, make sure it isn't cancer. For a young woman with ovarian cysts and BRCA2, again, like Tracy, you did this surveillance at first, so you're doing that transvaginal ultrasound and a blood test called a CA-125 to screen for ovarian cancer. Unfortunately, at this time, we don't have great screening for ovarian cancer. So the recommendation is once you are at a point where you're done having children, or a point where you're not, decided you definitely don't want children, if that's the case for you, considering having that laparoscopic oophorectomy and salpingo oophorectomy, where you're removing the ovaries and fallopian tubes. There are some interesting studies out of like MD Anderson, for example, where they're looking at removing just the fallopian tubes to start, and then following up with removing the ovaries later, so that you don't go into immediate hormone withdrawal and go into early menopause. So trying to balance that out a little bit. So working with a gynecological oncologist to determine when and how to do that would make the most sense for you. But I think if you know that you have a BRCA2 mutation, as Dr. Bushkin mentioned, it's not one physician that you're seeing. You're probably seeing a whole team of physicians to manage everything. But again, like your primary care doctor tends to be a good sort of quarterback to make a bunch of those recommendations or referrals and send you to the different clinicians that would help manage your care.
Yeah, and that's why it helps to be in a group like yours, Dr. Bushkin, where everyone's in the same place.
Yep, love a practice that covers everything.
Yes.
Awesome. As we wrap up, Tracy, any final thoughts? I mean, this has been a lot of great information. We're, of course, going to repost on all of our platforms, but so needed, so important, especially today on National Cancer Survivor Day.
Really just stay tuned for updating information on clinical trials, different information on different ethnicities, and know your options. Knowledge is power. Early detection is key. And again, remember, guys, breast cancer doesn't quarantine. Book your appointment, book your mammogram, book your MRI. If you need funding, feel free to reach out to myself if you can't find anybody in your state, and we will provide you somebody to get that mammogram or ultrasound or MRI done. Early detection is the key, and I'm really grateful that we were able to have Lily and Bushkin on, and sharing the information about the Caribbean history is really important. And, here at BRCA Strong, we like to have a very diverse group and always educating on what's next. And I feel like when we found out African-American Black women had a 40% mortality rate, kind of just opened my eyes to let's see what else is out there. And then, learning about Caribbean, learning about endometrial cancer now being a part of BRCA too, just the different and the constant updates is so important. So thank you everybody for coming on. Genesis Care, thank you so much. We had an amazing event on Saturday. Today, I look forward to big announcements tomorrow with Genesis Care. And Nikki, it has been a true pleasure having you on BRCA Strong, working with you. And
we're going to do a follow-up, because I'm going to go get this test. We're going to do a follow-up, and we're going to share this information on all of our platforms, because this is a conversation that needs to keep going. The more you know, the more empowered we all are, the better life you live. This is about living, people. It's about living. Thanks, Dr. Bushkin. Thank you, Lily Cervias. And thank you, Tracy.
Thank you. Have a phenomenal day, everybody.
Yep. Thanks, Tracy.
Take care. Bye, Dr. Bushkin.
Thank you. Thank
And
you.
for all of you, before we hang up, just so you guys know, you can follow everybody on Instagram, and make sure you follow up with the new guidelines and all the information, because again, they change all the time, and it's so imperative to know your options. So have a great day.
And save this so I can retweet it, Tracy.
I'm saving it. It'll be you in 5 minutes.
Thank
Bye,
you.
everybody.
Thank you.